Likely the nation could see its fourth COVID vaccine in about a month and a half. This, as researchers announced the AstraZeneca version is about 79% effective in reducing your risk to the virus. Local 44's Jolie Sherman takes us to UVM Medical Center, where staff have been spending months conducting this third phase of an AstraZeneca trial.
There are nearly 80 sites performing the AstraZeneca trial around the country, and Vermont is home to one of them. Thousands of Vermonters signed up for the study, but it's only looking at a few hundred, many of which are 65 and older. Dr. Beth Kirkpatrick, the study's principal investigator, says this age demographic of 65 and older is what sets the state apart.
That's been something in all the coronavirus vaccine trials that people have struggled with, is making sure we're getting that age demographic, because that's really the age demographic at highest risk of getting sick.
32,000 participants nationwide have received both doses. Nearly 300 participants in Vermont were randomly assigned the shot or placebo and not told which one. But as Pfizer, Moderna, and J&J were cleared for use, they could find out.
Actually, the first person in the state of Vermont to actually receive the first shot of the trial.
Chief Don Stevens will continue with the study for the full 2 years. Though not yet authorized, he says he still feels protected by the shot.
Efficacy rate of catching it was the less concerning of hospitalization and severe illness. So that's 100%. So that makes me feel really good.
While the country expects to have enough vaccine by mid-spring, Dr. Kirkpatrick says there's still a need for a fourth one, especially with new variants popping up.
Now, if the data that came out today from AstraZeneca is true, that means it's probably a little bit more efficacious than the Johnson & Johnson vaccine. So I think it's nice to have options.
Because it's inexpensive, easy to make and store, Dr. Kirkpatrick says it could become the most widely available vaccine in the world. Reaching these final efficacy numbers is a milestone for the trial. Dr. Kirkpatrick says while she's aware of the concern of this drug in Europe, the U.S. trial did not show an increased risk of blood clots from participants. The Food and Drug Administration will review this data carefully in the coming weeks. Reporting at the University of Vermont, I'm Jolie Sherman.